Welcome back to Medicare Matters with Mackenzie. I'm your host, Mackenzie Anderson, and today we're talking about something that nobody plans for, but everyone needs to understand: emergency medical coverage for Medicare. If you've ever wondered, is the ER always covered? Why did my neighbor pay something different than I did? Or does Medicare cover ambulance rides? Or what about urgent care? This episode is for you. So, as always, today's discussion is for educational purposes only. Medicare plan details vary, so it's important that you review your specific coverage before making any decisions. So let's start with the biggest question. If someone has a true emergency and goes to the ER, is it covered? The short answer is yes. Medicare covers emergency services under what's called the prudent layperson standard. This means that if a reasonable person believes that their health is in serious danger, chest pain, difficulty breathing, signs of a stroke, Medicare treats that as an emergency. Under original Medicare, ER visits fall under Part B. After you meet your deductible, which is $283 this year, you pay 20% coinsurance of whatever that Medicare approved amount is. If you're enrolled in a Medicare Advantage plan, emergency services must be covered anywhere in the US, even if the hospital is out of network. Importantly, emergency care cannot require prior authorization, which is approval. Now, here's what many people misunderstand. Coverage does not mean zero cost. It means Medicare shares the cost with you according to your plan design. One of the most common questions I get is, why did my friend pay $90 and I paid $400 for the same ER visit? The answer is simple: coverage structure. There are three primary ways that people receive Medicare coverage. One is just original Medicare only, so we're talking A and B. The second is original Medicare, so A and B, with a Medigap or Medicare supplement plan. And then 3 is Medicare Advantage. Each structure handles cost sharing differently. Original Medicare uses the deductible and then a 20% coinsurance. There's no annual max out-of-pocket limit unless you have supplemental coverage. Medigap or Medicare supplement plans are designed to cover some or most of these out-of-pocket costs. Medicare Advantage plans typically use flat copays for ER visits, and they include a max out-of-pocket for the year. So yes, two people can sit in the same emergency room, receive similar treatment, and owe very different amounts based solely on their coverage structure. So that's why understanding your plan before you need it is so important. So our next question is, what about ambulances? Medicare covers ambulance transportation when it's medically necessary, meaning other transportation could endanger your life. Now, this is where Medicare differs from your employer plan or commercial plans, is it has to be coded as an emergency, meaning you actually need it. If you fall or something, the ambulance comes and they want you to go and you say, I don't know if I need that. The answer is probably, if you don't think you need it, maybe don't use it, because then there's always that potential of you having to pay for the full cost, because if they don't code it as an emergency, then it won't be covered. So under original Medicare A and B, you have the deductible and then 20% coinsurance. With the Medicare supplement plan, it just depends on whatever plan you have. Medicare Advantage plans will cover the ambulance, but Medicare may not cover the transportation simply because it's convenient. The key factor is medical necessity. If your condition requires emergency transport for your safety, Medicare generally will provide that coverage. So let's talk urgent care. Urgent care is typically covered when the services are medically necessary, but there are some differences to understand. Under original Medicare, the urgent care provider must accept Medicare for the standard coverage to apply. Under Medicare Advantage, network rules can impact the cost sharing. While emergency services are covered nationwide regardless of network, urgent care is not always treated the same way. That's why reviewing your summary of benefits matters. Another important distinction is observation versus inpatient admission. If you're kept overnight in the hospital, you may assume you've been admitted, but sometimes you're placed under an observation status. This classification can affect how services are billed and what portion Medicare covers. Understanding these differences ahead of time will reduce your confusion during an already pretty stressful event. So let's talk about prevention, and not medical prevention, but financial prevention. There are some things that you can do today to avoid surprise costs later. You can review your deductible and coinsurance amounts. Know whether you have supplemental coverage. If you have Medicare Advantage, know your max out of pocket, what your copays are. Keep your insurance card accessible. Review your summary of benefits annually during the enrollment period. But emergencies are unpredictable. Financial preparation doesn't have to be. There's also something else that you can add to it. It's called the hospital indemnity plan. They're offered by private carriers, but this plan is designed, you attach it to your Medicare Advantage plan. So for example, let's just say your hospital copay is $100 a day for 5 days with an Advantage plan. You can have that hospital indemnity plan reimburse you $100 for 5 days. So if you go to the hospital, you get out one day, you have $100. That hospital indemnity plan can then pay you, reimburse you for that, whatever it is. A lot of them have ER reimbursement, emergency room reimbursement attached in there. You can also add in, cancer lump sum, physical therapy rider. The possibilities are endless. So in closing, I'm going to recap. So yes, Medicare covers emergency room care when it meets the prudent layperson standard. Yes, ambulance rides are covered when medically necessary. Yes, urgent care is generally covered, but network and provider participation matter. And yes, you can pay, what you pay can vary significantly depending on what your plan is and what your coverage is. The most important takeaway is this: Medicare provides access to emergency care, but understanding your specific plan details determines your financial experience. That's why education matters. That's why this show exists. If you have any questions about this, or you're interested in a hospital indemnity plan and seeing how that would work with your coverage, just let me know. Thanks for listening. Thanks for listening to another episode of the Medicare Matters podcast with Mackenzie. Please make sure to subscribe wherever you get your podcasts so you don't miss an episode. Please also leave a review, as that helps me reach more people that can benefit from this podcast content. If you have questions or topics that you want me to cover for a future episode, please email them to Mackenzie@premiermedicaresolutions.com.